We have them scheduled once a month, and they're all posted on the HODS website, but lower extremity is next weekend. All right. And you can look at March. Sure.
I'm so proud of these guys and about the collaboration with Hands-On Seminars on this program, because this is the only fellowship program in dry needling. This is not just, it doesn't take you only through just learning how to perform dry needling in a reimagined way, but also at the completion of that educational component, it has attached a fellowship part where you are going to treat patients, send in the methods that you treated the patient, pictures, results. There is like various things that you have to send into Danica, and challenges also in the treatment. And she guides you through then that, okay, thumbs up, good job, or maybe you could have done this, maybe you could have done that. So in dry needling, guys, as it is important how you are going to do something, it is even more important where you are going to do it. The location where you are going to put the needles. It is so paramount. You know, I have seen time and time again people having some radiating pain in their forearm area, and I see dry needling therapists sticking needles in the brachioradialis. The moment that this all came up from the scalenus muscles, that they were or the SCM, that they were supposed to be treated. You know, it is so important how you will select the proper muscles to treat, and then to utilize a very effective way to treat them. So you guys are doing an amazing job on this. So very well done.
Yeah. I will say too, you know, like I said, we've been with them since December. Danica is always a resource, but we email, text, whatever. If I have an issue in doing, and then she makes suggestions. Oh, well, why don't you do this? Because I'll be honest, as Angie and I were talking, we've only done upper, but I've already done backs, and I've done some lower stuff right there, but with some coaching. Yes, I know I've been rogue. That's what Swathi, my other therapist, who has not gone that far, but yeah, Danica is a great resource when you're not here as well.
That's the biggest difference is, you know, you go to these weekend courses, and, you know, it happened to me too. I went and took the course, and then I had a question. Wait a minute. Someone's on an anticoagulant. What do I do? Crickets. So that's not helpful. So I'm happy to be here as a resource for all the, I don't know, collective millions of people that we've dry needled here at Apex. So happy to be here and of service.
Guys, round of applause again for Apex. Thank you so much for hosting. This has been an amazing leadership conference. I can't tell you. I'm kind of going back to Apex for a minute. I think all of us at heart for the last several years, having been able to rub shoulders with Angie and Joe, we're all kind of Apex wannabes. Come on, we are, right? Yeah, absolutely.